Hello, my dear friends. Today we're going to talk about what's the options not to do the root canal treatment on the tooth with a big decay. My name is Dr. Dmitry Gorbatov, and I'm practicing cosmetic and holistic dentistry for the last 33 years in Hollywood, Florida, right on South Ocean Drive. So what's the options? What's the procedure called to preserve the tooth from root canal treatment? We call it pulp capping. So usually when you have a big cavity inside of your tooth and you start feeling it occasionally, so you go to the dentist, you know that something has to be done, and doctor take the picture, said, oh, this cavity is very deep, you would need a root canal. So we do a different protocol when we see people who got deep decay, but basically the tooth is alive and tooth have no abscess. And we see that the cavity is deep, but there is a possibility, it's only minimum openness from that cavity to the inside of the tooth, to the pulp of the tooth. So there is a way to do pulp capping. So what the pulp capping is, so basically we very conservatively and accurately remove all the decay from that cavity, layer by layer, layer by layer. Let's say we go up there and there is a connection between that cavity and the pulp of the tooth where the blood vessels and the nerves are. And it's a minimal invasive connections. So most of the doctors just go and don't take the risk and they just do the root canal and the tooth is dead and basically this is it, tooth is dead. We try to keep the tooth alive as much as we can. So we put special, we do the disinfection inside of that cavity. We cover that openness with the special materials which promote the anti-inflammatory property of the pulp. And then we close the tooth with the temporary restorations for 2 to 4 weeks to see what happened. If the patient have no symptoms and after 3 to 4 weeks, and we see that there is no site of inflammation inside of the tooth, so it means the circulation of the tooth is good, the tooth is not inflamed inside, and the immune system is handling that invasion of the bacteria inside. Then we restore the tooth with the proper restoration, could be inlay only or crown, it depends on the condition of the tooth. Meanwhile, when we put you and waiting for those 2 to 4 weeks for the outcomes of our treatments, we prescribe you vitamin C, which is you taking, it's an anti-inflammation drug, which help you a lot, you stimulate your immune system and stimulates the anti-inflammation properties of your body. So next time, before you go to the dentist and you have any questions about should I do the root canal, should I not, if it is possible to do the pulp capping, you can always contact us. We'll give you honest opinion if it's possible to do the pulp capping and save the tooth alive or it's not. So call us up, come, we'll do the examination, we'll help you out to make a proper, knowledgeable decision. Thank you very much for your attention. Please subscribe to our channel. Thank you again. Have a wonderful day.